Hey everyone. So I promised you a podcast, at least one a week, and I'll have to say that I had been remiss in week 5 here of putting something out this week other than some snippets of some other videos that I've done. And in truth, I got home at 2 o'clock in the morning Pacific West Coast time from Washington, D.C. earlier today, and it's now, I'm looking, 9 p.m. at night, and I'm sitting down here to talk. And I know I've made that commitment to you and wanted to at least come on and share with you some of those conference takeaways. December is a crazy busy month. Not only did we slide from Thanksgiving and now into Christmas, I've had the good fortune of speaking at the Risk Adjustment Forum in Dallas at the end of November, and then got the great privilege to go to Washington, D.C., to the SDOH Policy Summit. While I was there, I got to speak at the Member Accounting and Reconciliation Virtual Conference for RISE. And so I'll share with you some of the things that I spoke about there. And then on Sunday, I will travel down to San Diego, where I'll get to participate in the Women Leaders in Healthcare Summit. I love that event. And then also, too, I'll get to participate in a couple of different sessions at the Stars Rating Masterclass. And there's lots of stuff going on in our industry. And so I thought that I would take all of that, share some particulars, but also give you a summary, because I think that's one of the benefits of getting to participate and rub elbows with various industry leaders and getting to attend these events. And I think that having that overview is a good one, especially as you're thinking about strategies and other ways that you might be thinking about doing the work that you're doing at your organizations. I thought I would talk about 3 events. I know I mentioned about going to the Women's Conference and the Stars Ratings Masterclass. I'll bring you a more comprehensive report when I return from those events. And the Risk Adjustment Forum was held at the end of November in Dallas. And what I enjoy about that conference is there is usually a slightly different audience. I like that we're able to get into the nitty-gritty as it relates to risk adjustment. Not that we don't do that at other events, but there's just a different feel, I would say, to that event, a different level of expertise that the attendees bring. And so I highly recommend it, whether you are new to risk adjustment work and want to learn more from seasoned professionals, or you're a seasoned professional seeking out other seasoned professionals. I think it's a great event to attend. One of the things that I took away from there's a lot of concern over V28 and how it's going to impact the industry. But what I really appreciated that came out of that conference is that folks were talking about not only the impact to risk, but I saw what I like to think of as a raising the gaze, and people starting to talk more and more about the importance of interacting with other areas across healthcare. And so making sure to pay attention to total cost of care, making sure to pay attention to quality. What can we do to improve outcomes for patients? And this idea of whole person care. And I know we've been talking about it for a while in the industry. I know everyone knows that it's important, but I just heard more of it. And I thought that was really exciting. And that leads me into how I found the SDOH Policy Summit. Now, let me tell you, I saw the list of speakers on this event last year, and I was so impressed. And I was like, I'm going next year. And so I had the opportunity to go this year, and it was great. I really love policy. I think I could have a second career in Washington, or so I'd like to think. But anyway, what I enjoyed about that, and what I found to be a common theme across the conferences, is you had here federal agencies talking about the work that they're doing, the different programs that they have, the availability of grants and monies, and the federal government's commitment to investing into social determinants of health. And I was really privileged to lead a panel on the federal efforts to address hunger, nutrition, and healthcare. And I know that across the industry, we talk about the importance of food is medicine, but making sure that people have the food that they need in order to survive and to stay healthy. One of the things that I would caution or recommend people in the industry pay attention to is there's a lot of programs out there. I don't think we're talking to one another, just like we talk about silos existing within our individual healthcare organizations or risk-bearing provider groups, or even if we're a provider enablement company. It seems that there's silos across the federal government too. I know, big surprise, right? But you could hear that across the various agencies and the work that they're doing. And then also too, there were quite a few states that were represented, some very large health systems and health entities, as well as community-based organizations. And so it was really exciting. I know that the conference attendance has doubled in just a year's time. There were over 300 attendees at this conference. Love the discussion, love the networking, looking forward to hearing more and seeing more of what comes out of this conference in the future. If you have an opportunity, I suggest you go, because I just think it adds another flavor, another layer to better understanding the work that we do. And I think that everything that we do is so complex. To the extent that we can bring those pieces together just gives us a greater appreciation, a greater texture, again, to the work that we're doing. And then the other conference that I got to participate in, so I was in person in DC, but I also got to speak at a virtual conference that was going on, and it had to deal with Medicare Advantage member accounting and reconciliation. And I got to speak at two different sessions. So one, I got to share the reasons why member engagement is important in Medicare Advantage, and that it's not just about members being assigned to you and the premiums that they pay, that really we need to pay attention to risk adjustment, quality, and total cost of care on those members. And so in the first part of that presentation, I talked about the importance of engagement and just really gave a primer on what risk adjustment is, why we pay attention to it, what quality is, why we pay attention to it, and how these components fit into the larger milieu of what healthcare is. And then the second part of my presentation was more around engagement strategies. I talked a lot about learning and motivation, and then also provided some tips for better communication and teaching things around active listening, reminding folks of how the brain works, how we process information, and what are some steps you might take to better engage members. And these were strategies not only to be applied to the reconciliation process and working on issues one might have with billing, but really could be applied anywhere, whether working with teams or even, I think, in our personal lives. And then I got to participate in a session with reconciling patients, especially those that may qualify as a dual status, and then helping those patients access, or those members access, the supports that there are available to them. And I think that's important because, and that's why I started talking about V28 and what I heard at the Risk Adjustment Forum, or even what I heard at the SDOH Policy Summit, is that we think about these patients and they're entitled to these programs, and recognizing too that patients that are of dual eligibility often have more chronic conditions and other factors in their life that exacerbate condition. So to the extent that you can identify those patients, help them identify as a Medicaid recipient, and then helping them file the necessary paperwork to be attributed as such is so important. And we think about V28 and the challenges that maybe some organizations are feeling around risk reimbursement, but I think that this is a perfect opportunity to not only identify those patients, and we know that there are factors that are associated with that particular demographic that aren't with patients that are not of dual status, but then also too, going back to what I was saying about government programs and the grants that are available. And I really enjoyed the last three conferences that I've attended, even though I know it's been within a short amount of time. But I think that by doing so, I really got to appreciate the interweaving that there are all these great programs and people hard at work. And so, to the extent that we can familiarize ourselves and open up the conversation with one another and share this great work that's going on so that we could find the synergies across our organizations and do what's best for our patients and for improving healthcare overall. Thanks so much. Talk to you soon.